Hi, I'm Nick Beechey-Newman. I'm a consultant breast surgeon and I work here at the Harley Street Breast Clinic at 148 Harley Street and at the London Bridge Hospital in the Shard. I also do a clinic in the city at 31 Old Broad Street. Although the most important part of my role is the surgical treatment of breast cancer, when I'm not operating, I also run a number of one-stop breast clinics. So these clinics for anybody who has any concern about their breasts, such as a breast lump, breast pain, changes in the nipple, nipple discharge. And at a one-stop breast clinic, we're able to do all of the investigations that are required to reach a definitive diagnosis. So that may be a mammogram, an ultrasound, or a needle biopsy. And at the breast clinics that I run, we are able to do those tests within about 2 hours and give you all of the results of those tests by the time you leave. My areas of expertise in research include the avoidance of mastectomy in patients who have been diagnosed with breast cancer, sentinel node biopsy, which I helped to initially introduce in Europe in around 1995, nipple discharge, and the diagnosis and treatment of breast cancer in younger women, which means under the age of 35. If you have a breast problem, feel free to contact my team and book an appointment at a one-stop breast clinic. So the idea of a one-stop breast clinic is that any patient who has a breast problem can come and have all of the investigations that are necessary to reach definitive diagnosis in the space of just an hour or two. When you arrive at the one-stop clinic, I'll see you first and talk to you about your concerns and do a clinical examination. I'll then decide what investigations are going to be appropriate. This may involve a mammogram for women over 35 or an ultrasound scan really for any age. If you have a definite lump, very often we do also do a needle biopsy. But the point of the one-stop breast clinics is all of these investigations can be carried out while you're there. And after about an hour or two, we will have all of the test results available to you. I will see you at the end and discuss the results with you. One-stop breast clinics are really for anyone who has a concern about their breasts, and that may even include men if you have a problem around the nipple. So this may be breast lumps, changes in the nipple, nipple inversion, nipple discharge, changes in the skin of the breast pain, or generalized breast enlargement. The one-stop breast clinic is sometimes also just useful to do a routine breast check, and some people come to it for that. So if you have any of those problems, do feel free to book into one of our clinics. Of course, some women will be diagnosed with breast cancer at these clinics. And the way that they're run is that the full result of the core needle biopsy usually takes a day or two. So although the patient will be warned that this is a likely outcome, it doesn't come as such a shock because the full diagnosis won't come through for a day or two. This seems to work very well actually in breaking the bad news. Obviously, some patients will have adequate private medical insurance, and subsequently all of their breast cancer treatment can be carried on from there under their private medical insurance. If they don't have private medical insurance, some patients come to the one-stop clinic because they're very worried and they don't have private medical insurance and they pay for it themselves. Then we can easily arrange their transfer back into the NHS by providing them with all of the information, including the scans and pathology reports. And I will provide a comprehensive summary of their visit to the One-Stop Breast Clinic letter, which we can then forward via their GP onto their local breast clinic. Self-payment for breast cancer treatment in the UK is pretty expensive. The surgery probably costs around £5,000 or £6,000, which some people definitely do themselves. Chemotherapy is considerably more expensive, and radiotherapy also. So those can be done usually through the NHS, and some patients do mix and match and perhaps have their surgery done privately and their radiotherapy perhaps done through the NHS. Although gene testing for breast cancer is done much more commonly now and is often in the news, in reality, most patients who develop breast cancer, it is not due to an abnormal gene. So for instance, if you take 100 patients who have just been diagnosed with breast cancer, about 3 of them would have abnormal genes. These patients often have the signs of that in their families. Often 2 or 3 members of their family may have had breast cancer, some of them also ovarian cancer. And typically these cancers that are caused by abnormal genes are diagnosed at an early age, perhaps in their 30s or 40s. So patients who have a family history like that, whether they've just been diagnosed with breast cancer or have not had breast cancer themselves, can have genetic testing. And this is done usually with a blood test, but it can be done just with a smear from the inside of your cheek.